Hello and welcome. I'm Dr. Lakshmi and you're watching the Health Talk session by Yashoda Hospitals. Despite the growing numbers of inflammatory bowel disease in India, the awareness about it is scant and shrouded in a thick veil of misconceptions. Most of the patients still struggle to access a gastroenterologist with specialized knowledge about inflammatory bowel disease. So let's discuss about IBD in our today's episode. So let's welcome Dr. Santosh Enaganti, consultant gastroenterologist and interventional endoscopist from Yashoda Hospitals, High-Tech City. Welcome to the program, Doctor.
Hello.
So, Doctor, inflammatory bowel disease in the recent times is causing a significant healthcare burden on the system. So, to begin with, what is IBD?
Inflammatory bowel disease, as you said, we are hearing more frequently nowadays, and it is a condition where intestines will have inflammation, which is swelling of the inner lining of the bowel. Sometimes it can cause ulcers, and this will result in change in the bowel habits, abdominal pain and mouth ulcers. These patients can have ongoing symptoms, but each person will have a different level of symptoms. This condition can affect intestines starting from the mouth to the anal canal, and there are two types of inflammatory bowel diseases. One is called as ulcerative colitis, which predominantly affects the large intestine, and it tends to cause bloody diarrhea, change in the motions and nighttime diarrhea. Whereas other condition called as Crohn's disease can cause inflammation at certain areas, leaving the bowel unaffected in certain areas, what we call as skip lesion, and then these patients can present with low blood count, weakness, tiredness, change in the bowel habits, and sometimes predominantly pain.
So, Doctor, there's another term, that is IBS or irritable bowel syndrome. How do they differ from each other?
IBS is a similar sounding name, but it's an entirely different type of pathology where patients will have symptoms of altered bowels, insensitivity to some food items, abdominal pain, cramps, and sometimes diarrhea, sometimes constipation. In these patients, investigations will all come back as normal, and endoscopic investigations will not show any abnormality. So, basically all the tests will be normal, but they have symptoms related to the intestines. So, this is mainly due to the functional bowel problem. So, that means having some sensitivity rather than allergy to certain food items, and these symptoms can mimic inflammatory bowel disease, but the main differentiation feature is these patients will not have any weight loss, abnormal blood counts or abnormal findings on the investigations.
So, we know that genetics, immune response and change in dietary pattern lead to many diseases. So, what exactly causes IBD?
IBD once upon a time called as idiopathic disease because we did not know what was triggering the IBD. It normally affects people in the northern hemisphere, colder countries, more commonly Caucasians, Europeans. But unfortunately, Indians are the next common group of people who are prone for these things. That means certain types of IBD related genes in some people make them develop this inflammatory bowel disorder after a bout of infection in the bowel. Sometimes it can be food poisoning, sometimes bacterial infection, like a simple gastroenteritis. In a person who is prone for these genetic predisposition will develop inflammatory bowel disorder. So, it is not certainly a hereditary condition, but it can be present among the family members because of this genetic tendency.
So doctor, you've mentioned that in IBD there is significant inflammation of the gut leading to symptoms such as chronic diarrhea and rectal bleeding, which are still considered inappropriate to discuss. So how do you think we should deal with this issue?
Normally, in any age group, sometimes change in the diet, traveling, external food and junk food, all these things can cause change in the bowel habits, diarrhea, which typically lasts for a day or two and at the most 2 weeks. If anybody continues to have these symptoms beyond this period and then it is interfering their lifestyle, that's when we need to encourage them to seek for help so that we can differentiate whether they are having irritable bowel syndrome, which can be seen in 20-30% of people after a simple diarrhea, or is it because of the something more sinister, inflammatory bowel disease. The treatment for this one is completely different. So once diagnosed, we can effectively treat and control their symptoms so that they can have a healthy lifestyle.
So discussing about screening tests, doctor, what are the tests done for this condition?
To start with, one need to do the routine stool examination to make sure that there is no infection triggering these symptoms, followed by complete blood count and also some inflammatory markers called CRP, ESR. If these screening tests come back as abnormal, then we can do certain further investigations. If these tests show different pathology, then we will treat those conditions and then monitor these patients for ongoing symptoms.
So apart from these regular routine tests, we also know that colonoscopy is also considered. So when do you think that this should be considered?
After doing screening tests, if the blood tests are showing anemia and high platelet counts and low protein levels, then there is one more test called fecal calprotectin. In younger population, sometimes this specific stool test will tell us whether to investigate or not. If it is high, normally it should be 50, and if it is coming as 500, 600, then there are the patients who are likely to have inflammation in the intestines. So this group of patients who have pathological symptom, that means abnormal blood test, bloody diarrhea, ongoing pain, weight loss, these are the group of patients where we consider colonoscopy, which is an examination of the large intestine mainly and also the last part of the small intestine where this IBD is very, very common. So by doing colonoscopy, we can diagnose the severity, extent and as well as the type of the colitis or IBD, and we will take the biopsies to confirm the condition, and also sometimes we have to rule out conditions like TB if it is affecting predominantly small intestine. So it works as a confirmatory test as well as it tells us how bad is the IBD.
So apart from these routine blood tests and colonoscopy as we've discussed, is there any role of CT or MRI for this condition, doctor?
Some of these patients can first time present with intestinal obstruction and abdominal distension like a surgical cause. So in that group of patients, we tend to do the CT abdomen initially. In a known case who already have a diagnosed inflammatory bowel disorder, CT will be done if they have sudden onset abdominal pain and fever to make sure that there is no complication like perforation, leak from the intestine. Whereas MRI scan is done to monitor the extent of the disease, response to the treatment. Sometimes some of these patients develop burnt out disease, that means they had inflammation that healed by forming a scar, and other parts of the bowel may be having active inflammation. So by doing MRI with contrast, we will know which part is healed, which part is still active, and we can modify their treatment and sometimes submit them for surgery if they are having obstruction at that site.
So once a patient is diagnosed with IBD, what are the treatment modalities available for this condition, doctor?
IBD treatment is very elaborate and it is customized for the patient's severity and symptoms. If somebody has very early IBD, we give modified anti-inflammatory medications like aspirin, a group of medications called mesologen. Sometimes if the severity is more and they are more sick and the inflammation is more on the endoscopy findings, we add steroid medications which can be given for few weeks to few months, and then if they require long-term steroids, we tend to give immunosuppressive medication called azathioprine, and there are also much more powerful medications for severe form of IBD where there are already complications happened. So this will be customized based on the severity of the symptoms in the individual patient, and one of the aim of these treatments is to prevent future surgical complications requiring resection of the intestine.
So now discussing about the important part, are there any preventive measures that one can follow for this condition, doctor?
It is considered to be a disease of the immature bowel immunity and clean living. So that means if childhood infections and other things are not developed in these patients, and then the gut did not have a chance to mature, inflammatory bowel disease is supposed to be common. So unnecessary deworming in a healthy child should be avoided, and smoking plays a bigger role in the severity and then the extent of the inflammatory bowel disease, particularly in Crohn's disease. So we should avoid smoking, and high quantity of fatty food also triggers first attack of inflammatory bowel disease, particularly Crohn's. But both Crohn's and ulcerative colitis first presentation can be due to undue stress. This causes first presentation of the IBD in a given situation where there is a simple gastroenteritis in a genetically prone patient. So avoiding stress, healthy eating, and avoiding unnecessary repeated courses of antibiotics, self-medication is one of the causes which can trigger IBD presentation.
So following a healthy diet, getting routine screening tests done, and following your doctor's advice helps prevent IBD, and also it gets detected at an early stage, making it much easier to treat. So before ending this episode, doctor, what message you would like to give to our audience out there as far as IBD is concerned?
As this disease has a bimodal presentation, that means it normally affects younger people in the ages of 20 to 30 years, and also those who are above the age of 65, but it is not very uncommon in pediatric age group also. So I would advise medical examination including blood test, and if required colonoscopy in anybody who is having blood in the motions, chronic symptoms, non-responding diarrhea with or without any family history, so that we can diagnose the IBD early and we can also control it effectively. There will be a lot of apprehension in having the invasive test, but which can be safely done under light sedation, under the guidance of anesthetic doctors, and then earlier the detection, the better the prognosis, and most of the people will have normal life expectancy, and there is a general risk of surgery up to 10 to 20% in severe form of IBD that can be reduced by proper early detection of this condition, which is going to be more and more common in India because of our population. As we are second most prone group of people in the world, we will be seeing more of these conditions in due course. So including doctors practicing in the peripheries and healthcare professionals should be aware of this condition, should be differentiated from simple IBS, which is a non-pathological condition, and it will not lead to any complications.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic inflammatory bowel disease or IBD, and don't forget to join us for the next time as well. Until then, take care and stay safe. Thank you.